Irritable bowel syndrome (IBS) is a disorder of the digestive system that affects approximately 15% of the population, making it a very common condition. Consequently, we will discuss the 5 most common signs and symptoms of irritable bowel syndrome. Abdominal pain and discomfort are the most prevalent symptoms of IBS, present in almost 90% of cases. This pain is most commonly cramp-like and often related to bowel movements, with relief commonly occurring after a bowel movement. Pain can occur anywhere but is most frequently located in the lower part of the abdomen, although the location of the pain can shift. It is often triggered by stress, specific foods, or bowel movements. Many types of food can cause pain, such as bread, pasta, wheat, rye, beans, onions, garlic, and even apples and pears. These foods are known as FODMAPs, complex carbohydrates that are poorly absorbed in the small intestines. Instead, bacteria digest these carbohydrates, leading to the creation of gas and bloating, making bloating and gas the second most common symptom. This occurs in more than 60% of cases, with patients often reporting their stomachs look like a balloon about to burst or experiencing uncomfortable pressure and fullness in their belly, along with constant rumbling and noise from the stomach. Gas and bloating typically increase towards the end of the day as food is digested and gas builds up. This indigestion of foods leads to changes in bowel movements, with some people experiencing diarrhea, others constipation, and some alternating between the two. Thus, the third most common sign of IBS is altered bowel habits, with these symptoms being equally common. 1/3 of patients experience constipation, another third diarrhea, and the remaining third have a mixed form alternating between diarrhea and constipation. Consequently, we identify 3 types of IBS: IBS-C, predominantly with constipation, IBS-D, predominantly with diarrhea, and IBS-M, with mixed bowel habits. This change in bowel habit is a critical symptom of IBS. The 4th most common symptom is urgency, particularly in those with IBS with diarrhea, where there is a need to rush to use the bathroom, reported in almost half of the IBS cases. The 5th sign is mucus in the stool, reported less frequently but still a common symptom. The cause of IBS remains unclear, but theories abound. One suggests a miscommunication between the gut and brain, leading to heightened sensitivity and pain. Another proposes an imbalance in the gut's microbiome. Early life stress, especially traumatic events, may increase IBS risk. Food sensitivities, distinct from true allergies, can exacerbate symptoms. IBS is more common in women, typically developing before age 50. Family history and psychological conditions like anxiety and depression are risk factors. Treatment varies by IBS type: diarrhea predominant, constipation predominant, and mixed. For diarrhea, avoid high-fat foods, caffeine, and artificial sweeteners. Low FODMAP foods, soluble fiber like psyllium, and probiotics are beneficial. Antidiarrheals like loperamide may help, but with caution against long-term use due to potential side effects. Antispasmodics and certain antibiotics can offer relief. Cognitive behavioral therapy and stress management play roles in treatment. For constipation-predominant IBS, a high-fiber diet is key, with gradual introduction to minimize gas and bloating. Laxatives like polyethylene glycol are a second-line treatment but should be used short-term. The mixed form requires a balanced fiber intake and may benefit from peppermint oil for cramps. Antidiarrheals, laxatives, and antispasmodics are used as needed. Recommended foods for IBS include ginger for digestion and nausea, lean meats like chicken and turkey for easy-to-digest protein, oats for soluble fiber, and low FODMAP vegetables like carrots and green beans.